Be aware of the high-profile reports in the media regarding Baroness Moan and her connection with PPE MedPro, contact with government ministers and the use of a VIP lane in relation to the procurement of PPE. Will the Secretary of State assure me, and more importantly, the public, that a full and thorough investigation will take place into these matters and that following that investigation, that report will be made public? Thank you.
Well, Mr. Speaker, I can do much better than that. We have commissioned a full investigation and inquiry into the government's handling of COVID, and as part of that, I'm sure that inquiry will look at our PPE. But it's important to put it in context. We secured 23.2 billion items of PPE. That was a huge step done at pace to help protect our front line.
We now come to SNP spokesperson Stephen Barclay.
Mr. Speaker, Conservative officials and their high-ranking associates have reaped the financial benefits of that deadly disease, shamelessly profiteering on public funds. The SNP has long sought to highlight the rampant cronyism and corruption of this government. This PPE plundering is the most egregious case we've seen so far. And in Scotland, the Scottish Government has robust procedures in place to ensure protection of procurement in healthcare. So how will the Secretary of State better regulate against the cronyism of his colleagues, and will he commit now to scrapping the UK Government's VIP lane for healthcare contracts?
Well, again, Mr. Speaker, it ignores both the pressure of time at the start of the pandemic and also the fact that this was an international competition with countries competing for very scarce resources. It is also the case that over 19,000 companies were offering PPE. Only 2,600, Mr. Speaker, passed initial due diligence checks.
We now come to Andy Carter.
Very much, Mr. Speaker. Number 2, please. Thank you, Mr. Speaker. To support operational resilience this winter, the NHS has set out plans to increase hospital bed capacity by the equivalent of at least 7,000 general and acute beds during winter. This is alongside £500 million of funding to support quick, safe discharge from hospital and free up capacity, and £1.5 billion of targeted investment funding for new surgical hubs, increasing bed capacity and equipment for elective care recovery.
Andy Carter.
Thank you, Mr. Speaker. I'm very grateful for the Minister's response there. Over the last 20 years, Warrington has had some of the highest level of new houses built in the northwest of England, but our healthcare infrastructure hasn't kept pace. We desperately need a new hospital. Our A&E is at breaking point. We don't have enough beds, and there's nowhere to park your car when you go and visit. In 2021, my NHS Trust submitted a bid to the Department of Health for a new hospital. Could you give us an update on where we are with that process? Well, I thank my honourable friend. He's been a long-standing advocate for a new general hospital for Warrington. The expression of interest has been received from the Trust, and we are currently in the process of reviewing expressions of interest for the 8 new hospitals and aim to announce a final decision by the end of the year. I recently met with my honourable friend to hear about the plans, and, Mr. Speaker, the people of Warrington could not have a greater champion than my honourable friend.
Derek Twitt.
Thank you, Mr. President. Can I associate some remarks with the honourable gentleman from Warrington South about the need for investment in the Warrington and Halton Hospital Trust? And it's important that both hospitals have that investment in. But can I say to the Minister that part of the problem with capacity is the lack of social care capacity in the community, whether that's in a home or whether it's in the patient's own home. Just recently, I had an email from the Chief Executive of Wiston Hospital, which is a large acute hospital, where 115 patients, Mr. Speaker, were in beds they did not need, and therefore should be going out of the hospital, out of a total of 721 acute beds, adult acute beds. Isn't this just an example where the government is actually failing to provide enough social care out in the community?
Yeah. Well, Mr. Speaker, we're investing the £500 million to create another 200,000 social care placements, but we have significantly increased the number of physical beds available in our hospitals. So in July, before we made the commitment to increase bed capacity, we had 96,375 general and acute beds compared to 97,350 in October. And we're also delivering that increased capacity outside of hospital, so this winter creating an extra 2,500 virtual ward beds.
Rhys Johnson.
Thank you, Mr. Speaker. Does my friend agree with me that it is high time that the outstanding care and skill of the staff at Hillingdon Hospital were matched by commensurate outstanding facilities, and therefore it is great news that Hillingdon is one of the 40 new hospitals that the government is building by 2030? And can he confirm that the full funding package will be announced soon so that the whole project can proceed as soon as possible?
Well, I thank my right honourable friend for his question. I know the Secretary of State visited Hillingdon Hospital over the summer. It's a hospital I am also aware of, Mr Speaker. There has been no greater champion of Hillingdon Hospital, but more broadly of the new hospitals programme than my right honourable friend. Mr Speaker, currently 5 hospital schemes are in construction, 2 are now completed, and we aim to announce the next 8 by the end of this year.
Senator Champion.
Thank you, Mr Speaker. 2 weeks ago, a 5-year-old constituent of mine, Yusuf Nazir, died because we no longer have intensive paediatric beds in Rotherham. September saw a record-breaking ambulance handover delays, and the proportion of patients waiting more than 12 hours in A&E rose to 13.8%, nearly double last September's figure. In the last 12 years, we've seen Rotherham's NHS being hollowed out. What is the Minister going to do to reverse this?
Firstly, let me thank the Honourable Lady for her question. I'm very sorry to hear about the case that she highlights, and I understand she's written to the Secretary of State on this issue. Ambulance waiting times, Mr Speaker, are not where we want them to be. Now, we have increased ambulance staff by 40% since 2010. We've invested another just under 5,000 more staff in NHS 111, 2,500 more staff in call centres, an extra £450 million last year into A&E departments, and we've created the £500 million discharge fund, which will improve flow through hospitals. And then, of course, that extra 7,000 extra beds this winter. We understand the system is under considerable pressure. I'd be very happy to meet with the lady to discuss the challenges in her own trust.
Shadow Minister Dr Alan Carr.
Thank you very much, Mr Speaker. The current state of mental health treatment sees increasing numbers of people languishing on waiting lists, becoming more and more unwell. 1.1 million adults denied treatment. Children stuck in emergency departments for days waiting for mental health beds. Is the government proud that the systemic cutting of a quarter of NHS mental health beds over the last 12 years has led to more patients receiving treatment in private settings? And does the Secretary of State know how much money is given to private mental health providers? And does the government honestly think they're getting good value for money?
Well, Mr Speaker, this is not my direct area of responsibility, but of course mental health does present challenges for accident and emergency and hospitals more generally. We are investing an extra £2.3 billion every year extra on mental health. We have 16% more staff. We have an additional bursary, Mr Speaker, to attract more people, nurses, into mental health. But we do recognise the challenges, and I know my honourable friend, the member for Lewis, is working hard to address them.
Stephanie Peake.
Thank you. Question number 3, Mr Speaker. Thank you, Mr Speaker. Reducing waiting times for diagnostics and treatment is a priority for this government. The delivery plan for tackling the elective backlog sets out steps to recover and transform outpatient services across all specialisms, including neurology.
Speaker, in March 2021, my constituents suffered a severe head injury. By the time they have their first neurology appointment in January 2023, they are waited nearly 2 years for treatment. In the meantime, they have been unable to work, rejected from disability benefits, and are in severe pain. Does the Minister accept that this wait is unacceptable, and can she outline what support the department is making available for those who are suffering whilst they wait for vital appointments?
Well, I thank the Honourable Lady. I know she raised her constituents' case in a Westminster Hall debate on the 22nd of November, and my understanding is that they now have an appointment for January. But there is absolutely a backlog from COVID patients. We know that. That's why we're putting over £8 billion over the next 3 years to deal with that backlog. That's in addition to the £2 billion we've already provided through the Elective Recovery Fund. We've already eliminated virtually the 2-year wait, and we are now on track by April to eliminate those waiting for 18 months or more.
Question number 4, Mr Speaker.
Thank you, Mr Speaker. I would like to thank all those who work in social care for what they do day in and day out for people whose lives depend on care. We're supporting care homes and agencies in their efforts to recruit staff, including with a substantial national recruitment campaign. In fact, colleagues may have seen some of the adverts while watching popular programmes like I'm a Celebrity. We have also added social care workers to the shortage occupation list so that social care can benefit from international recruitment to increase the workforce in the short term.
A recent report from the Motor Neurone Disease Association outlined at the MND APPG, which I chair, found that most unpaid MND carers provide over 75 hours of care per week, but many are unable to access respite services due to the lack of adequately skilled care workers equipped to care for the complexity of MND sufferers' needs. Will the Minister commit to increasing specialised training for conditions like MND within the social care workforce to protect carers' own health and well-being?
Well, my honourable friend makes an important point. I too have heard from family carers about the difficulties they have faced in getting skilled professional help, which in turn gives them support and respite. At the moment, we provide £11 million annually for a workforce development fund, which social care employers can access to help pay for staff training. And looking ahead, we're working on social care workforce reforms, of which training and skills will form a substantial part. And I will commit to looking into his suggestion that specialist training for MND care should be part of this.
Tim Farron.
Speaker, in the Lakes we have a problem with social care, being that although the people working in the care industry are phenomenal and talented and dedicated, our average age of the population is 10 years above the national average, therefore the number of people needing to be cared for is greater and the size of the workforce is smaller. Undoubtedly, poor pay, poor conditions and a lack of career prospects are a major problem in recruiting and retaining the care staff that we have, but we also have an extra special problem in our area because of the absence or indeed the evaporation of the long-term private rented sector, which is where the carers normally would have lived. Will she talk to her colleagues in the Department for Levelling Up to make sure we have a comprehensive package for communities like mine in Cumbria, so we have well-paid carers and places for carers to be able to afford to live?
Yeah, I thank the honourable member for his question. He makes a really important point. Two things I'll say to him. Firstly, in the short term, through the 500 million that we're supporting social care with during this winter, the discharge fund, that will go into increasing capacity in social care and indeed addressing some of the workforce challenges in areas like his. In the long term, we're bringing forward social care reforms, including in workforce, and I recognise one of the things we need to look at is making sure there's housing available for the social care workforce.
Peter Byrne.
Mr. Speaker, listening to the Minister talking about increased social care, I don't recognise that in my area. Northampton General Hospital, which is one of the hospitals that serves my constituency, has around 150 patients a day who could be medically discharged, but can't be. This is 19% of the beds. At the same time, West Northampton Council is closing Spinneyfield, a 51-bed step-down facility in my constituency. Yet they have a PFI contract, and for the next 7 years they'll be paying £700,000 for an empty building. How can that be right? Will the Minister sort it out?
Well, I will take away and look into the specific example he has said in his constituency, because what I want to see is increased capacity and step-down care and social care during this winter and beyond, but particularly during this winter, supported by a £500 million discharge fund, which we're going to areas like his and across the country to help make sure that people who don't need to be in hospital can be out of hospital getting the care they need.
Richard.
Mr. Speaker, when will this new health team wake up to the fact that many of the things that we've been discussing already this morning, but particularly social care, will only be solved by treating local authorities as friends and allies and partners rather than the enemy? Please, could we have action to make local authorities full partners delivering every sort of care?
Well, hearing the honourable member's point, I should think that he therefore welcomes the fact that we've set up integrated care systems which bring together health and social care. The 500 million discharge fund I've been talking about, in fact, is allocated to local areas to be pooled into the Better Care Fund to be spent jointly between local authority and the NHS. Secondly, though, funding is an important part of this. In the autumn statement, social care received a historic funding settlement of £7.5 billion over the next 2 years, so that's important as well as clearly hand in hand NHS and local authorities working together.
Jim Shannon.
Question number 5.
Thank you, Mr. Speaker. We held a successful call for evidence for a new cancer plan earlier this year, which received 5,000 responses. We're now considering those responses and how we can best support the diagnosis treatment of cancer patients. I will be in a position to update the House shortly.
I thank the Minister for her response, but it's been 5 months since the 10-year cancer plan was due to be published in July. It's been 10 months since the war on cancer was announced in February, and while government has delayed, cancer patients have been facing unacceptable waiting times for diagnosis and treatment. Performances for the 62-day wait between a GP referral for suspected cancer to first treatment over the last 5 months has been the worst 5 on record. I say that very respectfully to the Minister, but does the Minister agree that what we really need now, this House needs and the people of this country need, is a long-term and ambitious plan to reduce these waits and to ensure that cancer patients in this country have the best outcomes possible? And will the Minister set out a timeline, not just say shortly, set out a timeline for delivering such a plan?
Well, I can't comment, as the Honourable Gentleman will know, on what's happening in Northern Ireland, because health is a devolved matter. I can only update on what's happening in England. And we are not waiting for a cancer plan to start on the backlogs. That's why this government is investing £8 billion over 3 years to clear the elective backlog. And we are seeing record numbers of patients. Cancer treatments continued throughout the pandemic, but we are seeing a higher number than usual coming through. We've seen over 129% increase in patients getting urgent GP referrals compared to September 19. But despite that, we are seeing 91% of patients in England receiving their treatment with 31 days of a decision to treat, compared to in June just 87% of patients in Northern Ireland. So I would suggest, while we are very, very committed to reducing that cancer wait time, he may wish to speak to the Minister in Northern Ireland as well.
I get through.
Speaker, with diagnostic activity, whether in vivo or in vitro, forming part of over 85% of clinical pathways, will my honourable friend confirm that due recognition of this will be reflected in the 10-year cancer strategy?
Well, can I thank my honourable friend for all her hard work as her time as a health minister. And absolutely, we are going through the responses right now. And as I indicated already, we will update the House shortly. But I will very much take her points on board.
Dame Baker there.
Thank you, Mr. Speaker. Mr. Speaker, my constituent Jessie, who's 24, was diagnosed with a type of brain cancer, grade 4 glioblastoma multiforme. This is devastating to her. She has had a very difficult year of treatment. But crucially, after her initial round of treatment, there were delays with her being able to access a scan due to the backlogs in the NHS and the real need for a proper cancer care plan to make sure that she gets her scans as regularly as necessary, as other patients need it as well. Hers was 2 months later than the standard of care, leaving her in absolute fear and terror that her cancer would come back, and that fear is almost as bad as the disease itself. So what plans has the Minister got to make sure that the 10-year cancer plan really gets to grips with this backlog which is devastating people's lives?
Yeah. Well, I'm sorry to hear about the experience of her constituent, and I'm sure she'll welcome the 91 community diagnostic centres that have been set up already to provide a range of tests, whether that's CTs, ultrasounds, MRIs. We're expecting to deliver up to 160 of these community diagnostic centres in total, with capacity for up to 9 million more scans per year when they're fully operational. This will not just deal with the backlog, but will future-proof our diagnostic services going forward.
Then Caroline Dinan.
Mr. Speaker, the Minister will know that cancer is the biggest cause of death for children under the age of 14, and there are countless incidents of failure and missed opportunity in how we detect, how we treat and how we care for children with cancer. I'm really grateful to her earlier this year meeting my constituent Charlotte Farrell, who tragically lost her daughter Sophie. But does she agree with me that we need a childhood cancer mission embedded in the heart of any cancer strategy if we're serious about saving other families from that tragedy?
Well, can I thank my right honourable friend for all her hard work in this space. We did have a debate on the floor of this House on childhood cancers, which she led, and I was delighted to meet her constituent Charlotte, who's campaigning so hard on this issue. And I did promise her we would look at a child cancer mission as part of that, and we will be updating the House shortly on our progress.
Gabley.
Thank you, Mr. Speaker. My constituent, who is a full-time GP in her 50s, told me question number 5.
Thank you, Mr. Speaker. Her question was about the recruitment of 6,000 GPs. Just to remind the House, there were nearly 2,300 more full-time equivalent doctors in general practice in September, and over 9,000 GP trainees in September 2022.
Ruth Cameron.
I'll pick up where I left off, Mr. Speaker. She's a full-time GP in her 50s. She told me the pension rules mean she either has to retire, work part-time or emigrate, which is hardly going to help her patients to get appointments with her. After hinting of a change on doctors' pensions this summer, the government is only now announcing a consultation that will last until next spring. So there's going to be no change in these crazy doctor pension rules until next summer at the earliest. Is this not too little, too late?
Yeah. Well, firstly, in terms of the numbers, it's worth reminding the House there's 3% more doctors this year than last year. We've got over 300 more full-time doctors in general practice, and as I say, we are recruiting more. On the point of pension, she's absolutely right that is a material issue. That is why we have launched the consultation, and we're working with Treasury colleagues to address those concerns as quickly as possible.
Virginia Crosby.
Thank you, Mr. Speaker. GP numbers are falling in Wales. Healthcare in Wales is devolved to the Welsh Labour government. And despite Arnes Morn being represented by 5 members of the Senedd in Cardiff, healthcare concerns represent a staggering 25% of my postbag. Does the Secretary of State agree with me that families right across Wales are not getting the healthcare they need and deserve from the Welsh Labour government?
Well, I do agree with my honourable friend. And indeed, I think one of the things that would help the House in terms of looking at the performance of the Welsh Government if there was more transparency. So, for example, if you look at the Opposition Day motion today, which talks about vacancies in England, Mr. Speaker, I'm sure it will surprise the House to know that the Welsh Government stopped collecting workforce vacancy statistics in 2011. I look forward to the bench opposite encouraging their Welsh colleagues to be more transparent.
Shadow Minister Ferriel Clark.
Thank you, Mr. Speaker. Mr. Speaker, members across the House will have been shocked and appalled by the recent deaths of children from Strep A, and our thoughts are with all those families affected. Cases are on the rise, and as we head into winter, it is vital that parents are able to get their children the care they so desperately need. The shortage of GPs means too many are struggling to see a doctor, and we are now seeing reports of shortages of antibiotics too. So what advice can the Minister give parents if their children are exhibiting symptoms but they can't get a GP appointment, and what assurances can they give on the supply and availability of antibiotics?
So the Honourable Lady does raise an important issue, and I know it is one that is concerning to many families across the country, and it's therefore helpful to be able to just reassure the House in terms of our response on that. And firstly, whilst GPs are important in this, so are directors of public health, and they are leading the response in areas including the liaison with schools. We are seeing an earlier peak than usual in terms of cases, these cases, and we believe this is due to lower exposure during the pandemic, which has then meant to lower immunity. There is no new strain, and that I think is one of the key points in terms of reassurance. But the UK Health Security Agency has declared a national standard, and that enables them to better coordinate our response, including across schools.
And then Colburn.
Question 7, Mr. Speaker.
The government is committed, Mr. Speaker, as we heard a moment earlier, to our 40 new hospitals programme by 2030. That is why we have committed. That is why we have committed £3.7 billion over. Well, he'll get a go in a moment. So I look forward to him welcoming the increasing capital spending that this government. And in fact, that's an increase not just on our new hospitals programme, but also on things like the electives. The £5.6 billion into more surgical hubs and CDC centres. But we are committed, and that obviously sits alongside the £1.7 billion of funding that has gone into over 70 hospitals in terms of delivering significant upgrades.
And then Colburn.
Mr. Speaker, Carshalton and Wallington patients will benefit massively from building a new hospital in Sutton and improving St Helier under NHS plans approved by this government. Can my right honourable friend agree to meet with me and the NHS Trust, because the trusts are raring to go to get spades in the ground next year?
Mr. Speaker, I know they're raring to go because I personally have spoken to the Chief Exec about this scheme, but I can offer him something better. The Minister of State for Health will personally be visiting shortly in order to discuss this further. But I also need to be transparent with the House. We are fundamentally changing how we are going to be building hospitals and the NHS estate into... I'm not sure why something as important, Mr. Speaker, as new hospitals, learning from the Department for Education and the Ministry of Justice through a more standardised model, which allows us to deliver more at a cheaper unit price and get those built quicker, is a source of mirth to the bench opposite. But it's important that we standardise those designs, and that is what my colleague, the Minister of State, will be discussing with him.
Hilary Benn.
Thank you very much indeed, Mr. Speaker. The new Children's Hospital, the new adult building and the maternity centre at Leeds General Infirmary will bring much needed new facilities to Leeds, the region and wider economic benefits. It's unusual amongst the hospital building schemes. As the Secretary of State knows, the site is clear and the plans are ready, so could I urge him to give the go-ahead as soon as possible?
Well, again, Mr. Speaker, I have visited that scheme. I did so over the summer. He will know that the costs have inflated significantly since what was signed off by the Treasury in 2019. And I think the point that has been missed by the front bench opposite is the way we deliver these schemes is to grip better the cost by using standardisation. That is what I will be discussing with Leeds General, because I agree with him. It is important that scheme goes ahead, and we need to work together to ensure that it does at a price that is affordable.
Mr. Speaker. Mr. Speaker, in July we made some initial changes to the reform system to support NHS dentistry. We invested an extra 50 million. We reformed the contract to create more UDA bands to better reflect the fair cost of work, introduced a minimum UDA to help practices where they're low, and allowed dentists to deliver 110% of their UDAs to deliver more treatment. The number of dentists doing NHS work last year was up 2.3%, but we're working on plans to go further.
Scott Benton.
Thank you, Mr. Speaker. The changes made to the dental contract last week were a step in the right direction, but fall some way short of the holistic reform that is required to help the estimated 25,000 of my constituents who do not yet have an NHS dentist. Will the Minister consider a change whereby the NHS funds subsidies to underprivileged areas such as Blackpool, thereby allowing NHS practice to offer a greater financial incentive to attract new dentists into those areas?
Absolutely, Mr. Speaker. My honourable friend and I have actually talked about this, and we are looking urgently at payment models and measures to address areas which are struggling to attract the right workforce. The commissioning of dentistry will be coming down to a more accountable local level in April, and we need to build on that.
Marika Lefort.
Thank you, Mr. Speaker. My constituents in Durham have told me tales of DIY dentistry, missing teeth, children in pain, and the unfairness of only being able to access dental care if they can afford to go. Things shouldn't be this way, and the BDA do not accept that the government's new plans go far enough to halt the decay in NHS dentistry provision. So will the Minister tell me when they will put in adequate funding and reform so people in Durham can get the dental care that they need and deserve?
As well as increasing the number of dentists doing NHS work and increasing the amount of work being done, we are, of course, taking further steps to look to the longer term and build NHS dentistry. The number of dental school places is up from 810 in 2019 to 970 in 2021, but of course we want to go further. We make it easier to have dentists to come to the UK and practice. In fact, we laid draft secondary legislation on the 11th of October to give the General Dental Council more flexibility to do that. And around the country, plans are advancing for centres for dental development to additionally provide not just dentists, but also hygienists and other nurses.
Question number 9, sir.
With permission, Mr. Speaker, I'll answer this and question 18 together. We're taking action on public health across the board. The £3 billion we're investing in the drug strategy will create an extra 50,000 extra places in drug treatment. We've doubled duty on cigarettes since 2010 and brought in a minimum excise tax. We now have the lowest smoking rate on record, and we'll go further. The £300 million that we're investing in Start for Life means new or expanded family hubs in 75 local authorities. And we're taking action right across government, from the £55 billion that we're investing in energy support to the measures that we're taking through at the moment to crack down on non-decent housing.
Peter Gibson.
Thank you, Mr. Speaker. Levelling up is not just about jobs and infrastructure, but it's about healthcare too. And dentistry is a key part of that. However, Darlington faces the potential closure of its surgery serving 7,000 patients because the current system of NHS dentistry makes the business case for that surgery unviable. What will my right honourable friend do to ensure that we level up dental services so that my constituents can get the services that they need?
Mr Speaker, my honourable friend and I have discussed this and are actually due to meet again shortly, and I repeat my offer to speak both to that practice and also to local partners so that we can tackle the crucial problem that he has raised.
Mary Robinson.
Thank you, Mr Speaker. Research by the University of Manchester adds to the significant body of evidence that says that addressing disparities in healthcare is key to levelling up. Inequalities have resulted in a 30% productivity gap in the North, which can be attributed to poorer health. Can my honourable friend outline how the government is working to address this and ensure that residents of the North are not at a health and care disadvantage?
Speaker, I saw that very important report, and I think the answer is that we have to tackle the problem from both the health and the economic ends. Spending on health in the North grew from £36.5 billion in 2018-19 to £52.6 billion in 2020, so there's a really significant investment in health and prevention of ill health in the North. In terms of economic activity, in terms of stopping people sliding into a cycle of ill health and worklessness, we are jointly working with the DWP to roll out more disability employment advisors and job centres. But the underlying key is to tackle and prevent ill health, hence the measures that I mentioned, the £3 billion for the drug strategy, the measures on smoking and the measures on energy and on housing.
Mr Speaker, I'll give you a very good example of health inequality. Until quite recently, we used to have a perfectly good consultant-led maternity service based in Caithness. But following the Scottish Government rubber-stamping decisions, pregnant mothers now have to make a 200-mile return journey to Inverness to give birth. That's a glaring inequality, and it is despicable, and I hope that Her Majesty's Government will share best practice in terms of tackling this problem with the Scottish Government.
Always keen to work constructively with the Scottish Government. It does sound like a very serious problem. My honourable friend has set out how we're using health spend, capital spend more efficiently. That sounds like an example where that's not happening, unfortunately, in Caithness.
Helen Morgan.
Mr Speaker, it's been well documented that people in rural areas have worse health outcomes than people in urban ones, and one of the drivers behind that is a lack of access for the most vulnerable people to be able to get to the services they need. So would the Minister consider working with his colleagues in the Department of Transport to figure out how we can provide the services we need for the most vulnerable people to access the healthcare they need?
Mr Speaker, this is why we are rolling out those community diagnostic centres to bring services closer to those who need it. It's also why we are investing in general practice and the extra 21,200 extra people working in general practice to make sure that rural services as well as services in the rest of the country are also improved.
In 2019, the Tories promised to extend healthy life expectancy by 5 years, but on this, Mr Speaker, they are failing. In the last year, the Health Disparities White Paper has disappeared, the Tobacco Control Plan has been delayed, and they've chickened out of implementing the obesity strategy because the Prime Minister is too cowardly to stand up to his backbenchers. And health inequalities are widening as a consequence. So does the Minister plan on reviving any of these strategies, or have the Conservatives now completely given up on prevention?
Mr Speaker, I've already talked about some of the things we are doing to crack on with improving public health and narrow inequalities, but let me add some more. We're also driving up blood donations for shortage groups. We're driving up vaccine uptake in the areas that it's lowest. I mentioned already the extra £900 million we're putting into drug treatment, taking to a total of £3 billion of investment over 3 years. I won't repeat all the things I've already mentioned, but we are across the board working at pace to improve public health and narrow those health inequalities.
Margaret Farrier.
Mr Speaker. Immediate CPR doubles or quadruples survival from an out-of-hospital cardiac arrest, and defibrillation within 3 to 5 minutes dramatically improves the chance of survival. That's why NHS England is establishing a network of defibrillators and community first responders, which aims to save up to 4,000 lives a year by 2028.
Margaret Farrier.
Thank you, Mr Speaker. On average, 150 people a day die from sudden cardiac arrest outside of hospitals. Access to defibrillators is crucial for survival rates. Without one, the chances of surviving drop by 10%.
every minute. I welcome the government commitment to roll out defibrillators across state-funded schools in England and Wales, but share concerns that because of significant ongoing supply chain issues, this may not be achieved. Can the Minister explain how the Department is helping to reach the target of supplying 20,000 defibrillators by 2023?
Well, as the Honourable Member says, access to a defibrillator makes a great difference to the prospects of survival for somebody having a sudden cardiac arrest, and that usually happens either at home or at the workplace most commonly. Since May 2020, the government has required all new school builds and refurbishments to have defibrillators installed. I'm very happy to look into the concern that she raises about that and get back to her. I'm also working on other initiatives to make sure that we get more defibrillators into public places.
Like many of my Lincolnshire constituents, I live in a remote village, and there's no prospect in the unlikely event that I have a sudden cardiac arrest. I'm sure that would disappoint people. There's no prospect of an ambulance coming within 10, 15 or even 20 minutes. I would have thought the government could make itself really popular in rural areas by having a massive campaign to roll out defibrillators in most villages. For instance, all those red telephone boxes that are now BT are closing down. That would be a good opportunity to put the defibrillator in one of those.
Well, again, my honourable friend makes a very important point. That's exactly why there is work going on at the moment to increase the number of defibrillators across the community. For instance, in villages such as his own, as he talks about, many villages will already have them. We're also supporting the NHS to train community first responders to make sure that there are people all across the community who have the skills to do CPR and use the defibrillators. And I do look forward very shortly to be able to announce a new initiative which will mean further defibrillators across our communities.
Catherine West.
Please. Thank you, Mr. Speaker. We are already putting social care reforms into practice. For instance, we want care providers to adopt digital care records, and over 50% have already done so. And I'm determined to shine more light on our social care system, so our new CQC-led assurance of local authorities' social care duties is going to start in April.
Catherine West.
Thank you very much, Mr. Speaker. One of the worst vacancy rates across the NHS is that of geriatricians. What urgent action is she putting in place to ensure that people in social care settings, either at home with domiciliary care or in social care settings, are seeing a geriatrician consultant regularly? And if there is a shortage, which I believe that there is, what action is she taking to have more doctors train as geriatricians?
Well, the Honourable Member makes an important point about when people are receiving social care, the importance that they also have access to the health care they need, and these systems working together across our health and social care systems. We are training more doctors overall, and we have an increase in medical school places, which is leading to more doctors coming through. I'm very happy to take away looking specifically at the question about the numbers of geriatricians that she raises.
Wendy Morton.
Thank you, Mr. Speaker. When it comes to delivering social care reform, will my right honourable friend agree with me that we also need to be looking at how the funding packages work, particularly across borders? I have a specific case of a constituent, Mr. Speaker, whose case falls between two local authorities. Would my right honourable friend agree to meet with me as a matter of urgency to make sure this poor constituent receives the funding that she needs for her husband's care?
Well, as announced in the autumn statement, we have announced a record funding settlement for social care of £7.5 billion going into the social care system over the next 2 years to improve both access and quality of care. I'm very happy to meet her and to look into the specific challenge that she has, because it is important that we have local areas working together across boundaries.
Shadow Minister Liz Kent.
Thank you. Mr. Speaker, let's just tell it like it is on the government's record on social care reform. Their cap on care costs was first promised 10 years ago. In 2015, they delayed it, and in 2017, scrapped it. In 2019, the Right Honourable Member for Uxbridge again promised to fix the crisis in social care, but last month the Chancellor buried the policy once and for all. After 12 long years, what have members opposite got to show on social care? The highest ever staff vacancies, Millions left without the care they need, hospitals full of people who don't need to be there, and families picking up the strain. Isn't the truth on social care? Just as with our economy, transport, housing and schools, they've run out of excuses, run out of road, and the country deserves a change.
Well, we have indeed delayed our social care charging reforms because we listened to the system and we heard local authorities asking for more time to prepare. And then importantly, we have allowed local authorities to keep the money allocated to that in their bank accounts to fund some of the current pressures on social care. But what I will also ask her to recognise is the record funding settlement for social care at the autumn statement, £7.5 billion for social care over the next 2 years, which she hasn't even acknowledged, coupled with the fact that we're pressing full steam ahead with our system-wide reforms to social care, supported by over £1 billion funding to support the workforce, to support the innovations in social care and to transform the quality and access of social care across the country.
James Wild, we'll keep going, don't worry.
12, please, sir.
I had it as number 13, but given the question, I can guess it's related to the build of the King's Lynn Hospital. I visited that site and looked at that scheme over the summer. I made clear in a speech I gave to the NHS providers that addressing the concerns of the RAC hospitals is my number one priority. Obviously, I cannot comment on individual schemes whilst the process is ongoing, but I can assure him we are working actively on it.
Thank you, Mr. Speaker. I warmly welcome the priority that my right honourable friend has put on resolving the serious RAC concrete issues at the Queen Elizabeth Hospital. But a decision on this was due in the spring. Well, Christmas is coming, and the only question people in North West Norfolk have is when we get the present that everyone wants of a new hospital for the staff and patients.
Well, I note the extensive support he has amongst parliamentary colleagues, including my right honourable friend, the member for South West Norfolk, who has recently added her support to the scheme. He'll also be aware that we allocated 20 million last year and 30 million this year to address some of the immediate issues, but we recognise it is a priority and we are working on it.
Sir Greg Knight.
Number 13, sir.
And Mr. Speaker, as well as making it more attractive to practice in the NHS, the number of dental school places is up from 810 in 2019 to 970 in 2021. We're making it easier for qualified dentists to come to the UK, and we're putting through secondary legislation at the moment on that, and we're also encouraging new centres for dental development.
Sir Greg.
Is the Minister aware that there is a particular problem in Bridlington in my constituency, where an increasing number of residents are not only finding it difficult to access NHS dental care, they're finding it impossible to do so, and that recently a dental practice in the town has closed down. So will he agree to meet with me on this matter to see what can be done to resolve the issue, hopefully sooner rather than later?
Mr. Speaker, of course, I'd be very keen to meet to try and address those issues and to build on the work that we're doing nationally.
Rachel Maskell.
Thank you, Mr. Speaker. York's had a dental desert for years, 6 years now, to see an NHS dentist, and the government have made no change to improve that situation, including bringing in more NHS dentists into my area. In the light in March, dentistry will be moving into ICSs and ICBs. How are they going to solve the problem?
One of the problems has been that having large remote regional commissioning for dentistry has meant that it's more unlikely that specific local problems will be picked up, and that is why we are taking the step that she has described. She's now complaining about it, even though it's a measure to get more kind of local accountability over the way that the services are commissioned.
Michael Fabricant.
Thank you, Mr. Speaker. Question 14. The Department has commissioned NHS England to develop a long-term workforce plan. This plan will help ensure we have the right numbers of staff, including doctors with the right skills, to deliver high-quality services fit for the future. This plan will be independently verified. We funded 1,500 more medical school places in England and opened 5 new medical schools in Sunderland, Lancashire, Chelmsford, Lincoln and Canterbury, and there are record numbers of medical students in training.
Michael Fabricant.
Well, I thank my honourable friend for his answer. He will know that it takes 5 or 6 gruelling years to get a Bachelor of Medicine or Bachelor of Surgery degree, or Doctor of Medicine in Scotland. But many students, having then graduated, think that they would prefer the more structured development of their lives by working as hospital doctors. What can we do to encourage young graduates to go into general practice? Well, I thank my honourable friend for his question. We've got record numbers going into general practice. This is the remit of my honourable friend, the member for Harborough, but part of the plan is to make it more attractive, so practice improvement through things like cloud-based telephony, things like the ARRS scheme, the extra 24,000 extra staff in primary care, developing multifunction staff so people can develop their skills, have specialism, but still practice as a GP2, increasing the use of pharmacy, movement more towards continuity of care, and of course the new GP contract for 24-25.
Thank you, Mr. Speaker. But when are we going to see the workforce plan? Because I spoke to a radiologist who runs a radiology department the other day. They're meant to be 15. They've only got 5. They've not had a single person apply. They need more radiologists, radiographers. We've got a national shortage of dermatologists, which is one of the reasons that skin cancers aren't being picked up. We've got a national shortage of pathologists and histopathologists. We really need a dramatic increase in the number of people working in the NHS. When are we going to see that workforce plan?
I thank my right friend for his question. As I said, we've committed to publish a comprehensive workforce strategy, which the Chancellor set out will be independently verified. That will be soon. We've set out new pension flexibilities. But, Mr. Speaker, it's important to point out we have 29,000 more nurses. We're on track to meet our 50,000 target. We've got 3,700 more doctors compared to last year, 9,100 extra nurses, and, of course, 2,300 more GPs.
Comes Dr. Sullivan.
Topical number 1, Mr. Speaker.
Mr. Speaker, we know that women can benefit from more personalised care, especially in pregnancy. The Tommy's app is a new clinical decision tool for the NHS and for women, another example of how we're using artificial intelligence to improve our maternity system. That will help end some of the variation in maternity care from hospital to hospital, and I'm pleased to tell honourable members, and in particular my honourable friend, the member for Rutland and Melton, who is a great champion of improved mental health, that today my department, through our National Institute for Health and Care Research, has agreed to provide the funding we need for the next stage of this app's development. And I want to pay tribute, Mr. Speaker, to Sienna and all those other babies stillborn to their parents, and thank all those in this chamber who have campaigned passionately on this important issue.
Helen Hayes.
Thank you, Mr. Speaker. Another dental practice in my constituency recently handed back their NHS contract. When I contacted local NHS management about the impact of this closure, they stated that the area in question was adjudged to be well served for NHS dentistry practices because there are 11 practices within a half-mile radius. But the experience of my constituents now left searching for NHS dental services is that none of these practices are accepting new NHS patients. What is the Secretary of State doing to ensure that assessments of the sufficiency of NHS dental services reflect the real situation on the ground? And when will we see a sustainable solution to the problems my constituents are facing?
Well, the honourable lady raises an important issue, and it is one of concern across the House, as we've already seen in the exchanges that my honourable friend have answered. That, in part, was why, during the pandemic, we used £1.7 billion of funding to protect dentistry. It's why we've got a commitment through the £3 billion a year funding of dentistry, but we're looking at how we localise that commissioning to get better value out of that contract, and that was the point my honourable friend raised.
Murray Robinson.
Mr. Speaker, at 1 o'clock today, patient safety expert Dr Bill Kirkup will be speaking to MPs at the whistleblowing APPG, to which all colleagues are invited. It's a timely meeting following this weekend's Newsnight programme, which highlighted yet another NHS trust where a culture of fear left staff unable to speak up on patient safety concerns. It's clear change is needed. Does my honourable friend agree with me that supporting whistleblowers in the NHS is crucial for patient safety?
Speaker, my honourable friend is so right about this. I praise her work with the APPG. I know that a lot of colleagues will want to attend it. Whistleblowers can save lives and improve healthcare. I've seen that in my own constituency. She's so right to be pressing on this.
Secretary of State West Streeting.
Mr. Speaker, the chairman of the Conservative Party claims that NHS strikes are exactly what Vladimir Putin wants. So why isn't the Health Secretary negotiating to prevent them from going ahead?
Well, I've seen him make this claim across the media a number of times, just to reassure the honourable gentleman, the right honourable gentleman. My door is open. I've been very clear with the trade unions. I'm available to see them this afternoon or tomorrow. It is not me, Mr. Speaker, that set a precondition on those talks. So there's a number of issues when I met with the trade unions that they've raised, not only pay, but around safety of staff, and other conditions, the estate, tech and so forth, and I'm very happy to engage with the trade unions on those points.
Mr. Treating.
Mr. Speaker, we get the warm words about wanting to negotiate, but a government source briefed the Times last week that his plan is to wait for public sentiment to turn against striking nurses, saying, and I quote, "This is going to affect a lot of people. It could have a big impact on a lot of them, and in the end, they will get fed up." He knows this winter is going to be the most difficult the NHS has ever faced, and he's using nurses as a scapegoat to avoid the blame. That's the shameful truth, isn't it?
Well, firstly, it's a bit bizarre that a department questions the best it can manage is, quote, a government source. And secondly, the revelation of that government source is that this will affect, quote, a lot of people. I don't think that comes as any surprise. That's why we regret the action and we're very open to having talks. The point is, he himself does not support the 19% pay demand of the trade unions. So he stands here saying we should be talking whilst himself not accepting their proposal.
There have been several changes of ministers, as we know, but officials have carried on working through these changes. So can we know what day, date and time the long-promised and overdue tobacco control plan will finally be published?
Whatever format our next steps forward are set out in, we will be pushing forward very, very quickly and aggressively on this. This year we're putting 35 million into the NHS to support services for everyone who goes in to stop smoking. We've double duty on cigarettes, brought in a minimum excise tax. Women who are pregnant now routinely get a carbon monoxide test. National campaigns like Stoptober have helped now 2.1 million people quit smoking. We're also supporting a future medically licensed vaping product as a quitting age. So we will be pressing forward at the greatest speed.
SNP spokesperson Steve.
Intellectual property protections are an important way of protecting healthcare companies' innovations. We know this. However, developments on intellectual property can also impact the rights of individuals, limiting access to affordable, life-saving essential medical products. What recent representations has the Secretary of State had with colleagues in the Department for International Trade, seeking assurances that nothing in the proposed free trade agreement with India will impact or jeopardise access to affordable medicines for NHS patients in Scotland? You don't.
Well, I can reassure the honourable gentleman on that, and I would have thought he would also welcome the commitment, the 15 billion to 20 billion increase in R&D investment, the championing of life sciences that my honourable friend, the Minister for Health, has been leading on, and the opportunity we have, particularly to address greater variation within the NHS by bringing forward the innovations from our life industry and applying those much quicker.
Alexander Stafford.
Mr. Speaker, several GP practices in Rother Valley, such as Swallownest Health Centre, operate a policy of having to ring the doctor's surgery for appointments at 8 a.m. Residents find themselves being placed 50th or 60th in queue, then they find there's no appointment available and be told to call back the next day. This is clearly not an acceptable way to offer appointments. What steps are my honourable friends taking to stop the current failed booking system and to instead guarantee a system of pre-booked appointments at all GP surgeries?
Mr. Speaker, this is something that we are working on very actively, as well as supporting financially GPs to roll out new and better ways of managing their appointments. We're also looking at what criteria we expect from GPs, because we already set out some moves in our summer action plan, but we will be looking further at preventing the lamentable situation he describes, where people are being asked to ring back or held in long phone queues. It's not acceptable.
Carl Turner.
The public aren't daft, Mr. Speaker. They know that the backlogs in the NHS existed well before the pandemic. They know that the NHS was already on its knees, and they know that it was this Tory government that brought it to its knees. So why doesn't the government take up Labour's policy of scrapping non-dom status, use the 3.6 billion to train nurses, doctors and midwives, get the NHS back on its feet? People in East Hull want nurses, not non-doms.
Well, the data is very clear, Mr. Speaker. In fact, it's very stark as to the extent to which the backlogs is driven predominantly by the pandemic, and that is why we have a programme through the extra investment in the autumn statement, the 6.6 billion over the next 2 years going into the NHS, but also the 2.8 billion next year and 4.7 billion the year after into social care, 8 billion in 2024, recognising the size of those backlogs so we can fund the surgical hubs, the diagnostic centres and others.
Speaker, I met with local care providers last Friday, and two main points they raised with me were concerns over energy costs and COVID in care homes. They were keen to see their nursing staff vaccinated with residents all at the same time. Whilst I recognise this happens in some places, can we look at this becoming the norm throughout the country?
Thank you, Mr. Speaker. My honourable friend makes a really important point. I'll say to her, the NHS is strongly encouraging local vaccination teams to vaccinate staff as well as residents when they visit care homes. This should be normal practice. I'm very happy to look into it if it's not happening in her area. And actually, I'd like to take this opportunity to encourage any health or social care worker who hasn't had their COVID or flu jab this winter to please go ahead and get one.
Fly Bafford.
Thank you, Mr. Speaker. Parents are becoming increasingly worried about the prevalence of Strep A at this moment in time. It's a time of year when parents are going to have children that have high temperatures and sore throats, and so concern is likely to be very high. There's also concerns about availability of antibiotics. So does the Secretary of State believe that this is a moment where the government needs to make a statement and show clear leadership to calm people down and reassure them about the situation?
Thank you, Mr. Speaker. We did hold a cross-party briefing for MPs last night on Strep A. We want to reassure parents if their children do have symptoms and they are concerned to seek help. GPs are ready, A&E departments are ready, and also we have directors of public health proactively going into schools where there are cases. There is no shortage of antibiotics. We want to reassure people on that, and we're keeping an eye on that on a daily basis.
Thank you very much, Mr. Speaker. The East Lancashire CDC already includes Burnley Hospital, and as part of that, we're opening 2 new endoscopy rooms in the spring. But myself, residents and the Trust know that the local hospital can do even more to reduce the COVID backlog with the right government investment. So would he agree to meet with me to discuss phase 9 of the hospital's development, which would bring a brand new radiology suite?
Well, I thank my honourable friend for his question. He's a strong champion for Burnley, and I congratulate Burnley General Teaching Hospital on the incredible innovative work that they are doing. He's right, CDC rollout 91 out of 160 is tremendous effort, but we do want to go further, and I'd be delighted to meet my honourable friend to discuss his plans further.
Last week, the First Minister of Wales, Mark Drakeford, said the pillar boards are not being funded at the level that we believe that they should be funding. And the Wales 2C General Secretary said, unless we've got a fairer funding settlement for Wales, we're going to struggle going forward. So, Mr. Speaker, when will this government listen to Welsh Government and the Welsh trade unions and provide a proper funding pay award for NHS staff that they deserve?
Similarly, direct her to the Barnett consequentials. As a former Chief Secretary and having had those discussions with the Welsh Finance Minister, you should know that actually Wales gets significantly more funding per head of population than England. And I hope she would welcome the fact that through the extra 6.6 billion in the autumn statement, the First Minister will have a significant uplift for him to decide how he wishes to spend that money.
Thank
you, Mr. Speaker. I was recently contacted by Amanda in my beautiful constituency, South West Hertfordshire, whose 88-year-old mother had fallen in her flat and unfortunately broken her hip. After a 5-hour wait and 2 calls to 999, her mother was still laying on the floor. Once they arrived at A&E, Amanda and her mother waited several more hours before being seen to. Can my right honourable friend reassure the House that he is doing everything possible to find a solution to this system-wide issue?
Well, I think he raises an extremely important case, and I'm very happy to meet with him to discuss this further, because I think it is a concerning case, and I'm keen to engage with him on it.
Thank
you, Mr. Speaker. My honourable friend, the Shadow Minister for Public Health, touched on the health inequalities later, but I didn't hear the Health Secretary recommitting to publishing the white paper by the deadline. Does he understand that the cost of living crisis and poverty is leading to greater health inequalities, and action is needed urgently now? And can he recommit to that white paper being published?
So we are absolutely committed to addressing health inequalities, and rather than simply looking at 10 years' time, what we're looking at is what are the immediate actions we can do, because what matters above he shouldn't have outweighed papers from the bench opposite. What I'm interested in is immediate delivery. What is it we can be doing now, rather than speculating about what is done in 10 years' time?
Mr. Speaker, we're seeing a sad increase in suicide rates across the country. And in 2012, the government then published a 10-year cross-government suicide prevention plan. And earlier this year, the government, under the leadership of my right honourable friend, the member for Uxbridge, committed to a new 10-year plan that will be published before the start of 2023. There is no sign of that cross-government 10-year suicide prevention plan at this point. But maybe I'm wrong. Maybe the government is about to publish this, because I know so much of the work on this has been done already. So can I ask my right honourable friend to show that he takes suicide prevention very seriously, and that to publish this plan as soon as possible?
Well, can I thank my right honourable friend and pay tribute to all his work in this area. He has driven this agenda forward. I want to reassure him that we are looking at that. He will understand that we have had some changes in recent weeks, but I want to assure him that this is tackling the issue of suicide is a high priority, and we will be making an announcement shortly.
Dr. Rupahat.
Thank you, Mr. Speaker. In a case that's sadly all too typical, a GP in Ealing who's seen their patient list go up from 3,000 to 9,000 in the last decade, put in plans approved for expansion, but NHS estates now won't cough up. What is the government doing to support doctors in inadequate premises? They can't expand their patient lists. What is he doing to help them expand and modernise in the current climate?
The amount of activity done by GPs, as the Honourable Lady knows, is up. It's about 7% up in October compared to the previous year. We are looking very actively at the way that capital works and the contributions of Section 106 and also of the local ICB as well, to make sure that, as well as having extra doctors, there's 2,300 extra doctors and the 21,000 extra staff, they also have good facilities to work in.
Speaker, access to dentistry is an acute issue for West Oxfordshire. Could ministers explain what they're doing to help rural areas like mine, and can we meet to discuss it further?
Well, Mr. Speaker, I've mentioned the fact that the number of NHS dentists was up 2%, 2.3% last year. We've talked about the extra 50 million and the reforms to the contract that we've already made, but we will go further, and particularly we do want to address those areas, particularly rural areas, where we need to get more provision urgently.
Speaker, the chair of the Royal College of GPs has expressed concerns about patients with chronic conditions such as asthma, diabetes and even serious mental health conditions refusing sick notes because they can't afford time off work. What discussions has the Secretary of State had with Cabinet colleagues about the adequacy of statutory sick pay during this cost of living crisis?
Well, I refer to the autumn statement where my right honourable friend, the Chancellor, set out a wide range of support packages to help those with cost of living across the United Kingdom, including the cost of energy, and that is part of wider discussions that we have on a regular basis with the Treasury.
Mr. Speaker, the pandemic has had a devastating effect on the number of people waiting for treatment. In 2019, there were 54 women waiting more than a year to see a gynaecologist. That number is now more than 40,000. What is my right honourable friend doing to reduce this wait?
Well, Mr. Speaker, to the earlier question, the gentleman's no longer in his place, but that's a good illustration that the challenge the country faces in terms of the backlogs is very much driven by the pandemic consequences. And what we are doing is working with senior figures like Jim Mackey and Professor Tim Riggs and the Get It Right First Time to look at the patient pathways, how we use our diagnostics, our surgical hubs, and streamline the way we get services to patients where those backlogs have built up.
Robin Robinson.
Mr. Speaker, and I'm grateful to the Minister for the answer she gave the Honourable Member for Eltham around Strep A this morning. Tragically, we learned that a 5-year-old girl died yesterday in Belfast, a P2 pupil at Black Mountain Primary School with Strep A. And so I'm grateful for her encouraging commitment that the penicillin is available, antibiotics are available, but can she ensure that our public health agencies across this United Kingdom cooperate with one another, and that if additional resource is required, that it will be made available?
Well, can I thank the right honourable gentleman? I'm very sorry, obviously, to hear about the tragic case in Northern Ireland. This is, we want to reassure people that while there is a slightly higher number of cases than would be usual for this time of year, that the UXA are, on top of this and are not concerned that there's a wider outbreak than would be expected. But we do want to encourage parents that if they are concerned that their children are not responding, to get help as soon as possible. Antibiotics are available, and there are local directors of public health should be coordinating local activity. But we are, if there are any concerns, do come and see me.
Thank you, Mr Speaker. On Saturday, I visited Chalkwell Grange, a brilliant new care home in picturesque Leigh-on-Sea, but they are struggling to recruit due to the guidance that all care workers should wear face masks. Would the Secretary of State give them the best Christmas present ever and remove that word should to can or may and put them in charge of their own infection control?
I thank my honourable member, and it's very good to hear that she was visiting a local care home and what she's heard from staff. I have also heard from staff, because while face masks are important for infection control, we also know that they have downsides like making communication harder. I have asked for updated public health advice on the use of masks in care homes, and I look forward to updating honourable members and the social care sector on the guidance on that shortly.
Daisy Cooper.
Speaker, my constituent is a victim of sexual misconduct by a medical professional, but they can't challenge that professional's fitness to practice because of the 5-year rule. The GMC wants the 5-year rule to be scrapped. The government consulted on whether to get rid of the 5-year rule more than a year ago. Could Minister please say whether it is the government's intention to scrap the 5-year rule, and would she meet with me so I can discuss how important it is that the GMC can explore whether a potentially dangerous medical professional who is still practising may be unfit to do so?
Can I thank the Honourable Lady's campaigning on this issue? It is a very serious issue. I'm very happy to meet with her. I would suggest we also meet with the Patient and Safety Commissioner, Henrietta Hughes, to discuss this further.
Peter Byrne.
Thank you, Mr Speaker. Could the Secretary of State give an undertaking to the House that no NHS or social care facility will be decommissioned and used to house asylum seekers, A, in Northamptonshire, and B, in the rest of the country?
Well, I'm not aware of any proposal along the lines to which he alludes, but on his earlier point, as I say, I'm very happy to meet with him to discuss the issue in terms of step-down care, and I'm sure any other concerns he has, there'll be an opportunity to discuss those at the same time.
I'm a little bit.
Thank you very much, Mr Speaker. My constituent, Margaret Crammon, is a full-time carer for her daughter. Throughout the pandemic, she was denied respite care. Now the care setting insists on testing for visitors and mask wearing for staff, causing distress to some of the young people being cared for who rely on vital facial recognition. Nearly all other COVID guidance has been reviewed, yet the guidance for respite care remains the same. Why are carers and those they care for always an afterthought for this government?
I'd point the honourable member towards the answer I just gave my honourable friend a moment ago on the question specifically of face masks, where I have asked for updated guidance for the social care sector on the use of face masks. I recognise the difficulties they cause, for instance, in communication, and I'm looking forward to be able to give an update to honourable members and the sector on this very shortly.
Speaker, what assessment has the Minister made of geographic variation in access to innovative liver cancer treatments, such as selective internal radiation therapy?
Well, it's a brilliant question on which to close, because I think one of the things all the House should be hugely interested in is how we are adopting innovation quicker and how we are industrialising that innovation across the NHS as a whole, as opposed to in silence. That is something we are particularly focused on within the department. It is a key priority, and I'm very happy to speak to the Scottish Government and others as to how we work together on that.
That completes the questions. Point of order, Gregory Campbell.
Thank you, Mr Speaker. During last week's debate on Northern Ireland and the reduction of MLA's pay, I raised the fact that absentee Sinn Féin MPs have received £10 million in various allowances over the last 10 years alone. The Northern Ireland Office Minister, the Honourable Member for Wickham, said he didn't recognise the figure. I asked the House of Commons Library to research, and they confirmed my figure is correct. I then furnished this to both the Minister and the Leader of the House, who is responsible for bringing a resolution to end this scandalous anomaly, where MPs whose Leader has said they have no business in Westminster continue to receive millions of pounds to do no business in Westminster. Has the Leader indicated to you that she plans to bring a resolution to end this scandalous anomaly?
Quick answer is no, but I'm also grateful to the Honourable Member for giving notice of his points of order. As he will know, I'm not responsible for the accuracy of the contributions of ministers or other members. If an error has been made, the record should be corrected. In any event, the Honourable Member has certainly put his points on the record. Right, let us now come to the 10-minute rule bill. Stephen Bonner.
Mr Speaker, I beg to move that leave be given to bring in a bill to make provision about employment rights, including the right to request more predictable terms and conditions of work, to amend the definition of worker and for connected purposes. Fairness, compassion and equality, these are not only the basics that should be afforded to each and every working person across these islands, but also how we can measure the effectiveness of governments upon those they serve. The COVID-19 pandemic has highlighted the many failings within